It increases appetite in the digestive system. It reduces nausea and vomiting. It calms and balances the stomach and intestines in a number of different ways. Everything from the inflammation that might be there from the immune system in something like Crohn's disease. It calms the centers in the brain that interact with the gut and the nervous system in the gut itself to help relieve nausea. There's many different mechanisms of action there. In the reproductive system, it decreases symptoms of PMS and menstruation. There was an interesting study done that looked at women throughout the month, and it was looking at their level of cannabinoids, or one specific cannabinoid called anandamide. And what we saw is that in the first half of the month, women generally had more anandamide. Their body was making more of this compound. And then after ovulation, that began to drop, and in the premenstrual and in the menstrual phase, it continued to decrease. Now, these women rated their symptoms. The women that were suffering from PMS and difficult menstruation the most had the lowest levels of this endocannabinoid, which suggests that they have, one way of thinking about this is a deficiency in their own cannabinoid system. And therefore, supplementing that deficiency with plant-based cannabinoids, with marijuana, helps relieve those symptoms. And we find clinically that it does that. Both symptomatically, it can help treat the symptoms, but it can actually prevent the symptoms from coming on if we treat after ovulation. Throughout menstruation, they can sometimes avoid the symptoms altogether. Like other glands in the body, it causes dryness, which is true in the vagina, which can be an issue for coitus. It can enhance libido and sexual pleasure, and it does affect sperm. It's not the same as what we've been told, that it makes you impotent or decreases your sperm count, but it does change something about sperm. If we look at under a microscope, the sperm that have been exposed to marijuana swim a little bit differently. And, and it's probably true that they might be less efficient at reaching their goal or more easily distracted. This isn't just a joke. It is. It's hilarious. But we see these metaphors, this at many different levels when we look at marijuana, from the macro to the micro. We see kind of the same thing happening. Also, it decreases the fluid in the semen because it's drying those glands. So less fluid might also have an effect. So I think that, if a couple's having trouble conceiving a child, and really if either one of them was using cannabis, I would suggest stopping just to try that as a treatment for fertility. Because in some situations, I think it could inhibit fertility. Not too much, though. In soft tissues, it decreases muscle spasms. It can decrease tender points by, a lot of times in tender points, there's these focal adhesions where the connective tissue gets kind of twisted up. Marijuana causes those focal adhesions to relax. It decreases inflammation in the soft tissues. This is really interesting now. In cancer, there's 4 mechanisms of action that we've discovered for the cancer-killing properties of marijuana. One compound is killing cancer in 4 different ways. I don't think we've seen anything like this anywhere in cancer treatment before. So it's, first of all, it specifically targets tumor cells. When it activates the cells, it inhibits their growth. Okay, so cancer cells, the big problem with them is they're always growing. This stops them from growing. It also inhibits the formation of new blood vessels to the cancer cells. So without a supply of nutrition, they'll die. They can't keep growing, they actually die. One point that I didn't list in here is it stops reproduction of cancer cells. So not only are they always growing, they're always reproducing. And this prevents that. It actually causes the cells to kill themselves. It's called apoptosis. It's a programmed suicide. And all our cells in our body have a trigger for suicide. And the cannabinoids actually stimulate that trigger on cancer cells. It's been studied in probably 7 or 8 different types of cancer, and has been shown very effective. We don't have human studies. We haven't been administering this clinically to humans in a controlled environment. But when we look in animals, when we take an animal with a glioma, a cancer in their brain, and we inject cannabinoids right into that tumor, it goes away and it dies. Sure, question?
This is the point to mention Rick Simpson.
Sure.
Can you tell us about him and what he's doing with that?
Sure, yep. There's actually a couple good documentaries. I see a lot of patients with cancer. Often they come to me, using marijuana to treat the symptoms of their cancer, the pain, or if they're undergoing chemotherapy, the nausea and the vomiting. And a lot of them are surprised to hear that besides just treating the symptoms of cancer, this could actually be a treatment for the cancer itself, a cure for the cancer. Unfortunately, well, not unfortunately, but what a lot of people don't realize is it's usually a different dosage. I think the dosage needed to use this as a safe type of chemotherapy is much higher than the dosage needed for symptom treatment. But anyways, there's two good documentaries that talk about this. One is free. You can find it on YouTube if you Google the name Rick Simpson. He's a patient that, and an advocate that found this to be useful for treating cancer. And he has come up with a way of making a very concentrated marijuana medicine. It's like an alcohol extract boiled down to a tar, so it's kind of like a hash oil. And by using this high potency marijuana extract, him and a bunch of people he's introduced to this have put their cancer into remission or cured their cancer. And so there's information about that on the web. Rick Simpson. The other documentary that came out this year that's excellent is called What If Cannabis Cured Cancer? Also, marijuana affects our mental and spiritual health. If you can see the picture, it's big smiles on Bob Marley, Mick Jagger, and Peter Tosh. I think it enhances enjoyment of music and art. People report that they're more creative and more inspired under the influence of cannabis. I think some of that is also bringing us into the present, helping us forget about the future and the past and focus on exactly what's happening. People report they can hear multiple instruments individually in a soundtrack. It can be useful for focus and attention in some people, and some strains of marijuana are better for this than others. In others, marijuana makes them more distracted. So again, it depends on your internal environment. Everybody's different. It can increase the awareness of the body. It can give people a sense of connection to others, connection to nature, connection to some greater whole, which is very important in healing. And it can give us a different perspective on our life's challenges. Sometimes we get so caught up in the process, and using cannabis can take you out of that process, even if just for a short time, and allow some perspective on that, which can unlock our thoughts about problem solving, healing, changing, growth. And while I'm talking about changing, one thing I didn't mention in the brain is that marijuana affects neuronal plasticity and nerve regeneration. So what that means is that nerves are often changing shape, making new connections with each other, and actually new nerves are being born. I know for a long time we were told once brain cells die, they're dead forever. We can't grow them back. Well, that's not true. And we were also told that marijuana kills brain cells. Actually, the opposite is true. Marijuana stimulates the growth of new brain cells. And it, as I mentioned before, it protects the brain cells that are already there. So I think that having that component of it might allow a person to learn or change their thinking patterns more. Because literally, when we change the way we think, there's a structural change that accompanies that in the nerves of our brain. New connections are being formed. And so to allow for new thinking and new ways of interacting with each other and with our environment, I think that marijuana can be helpful in that neuroplasticity component. All right, so the next part, that's kind of my summary on the effects on the body. As you can tell, I can probably get a lot deeper into a lot of that stuff. So before we move on, Ron.
Yeah, some people in the medical community have said that it causes depression, especially in adolescents. Can you speak to that?
Sure. Yeah, in one of these studies, not necessarily on depression, it was actually on more severe mental illness, came out of Maine Med in Portland recently. There's some good evidence that teenagers who use marijuana have there's a higher percentage of them that later get a diagnosis with a mental illness. Okay, we see when we look at epidemiologic studies, when we look at populations and look at trends like that, we see this all the time. A good scientist calls this association. So yeah, there's some association between teenage use of marijuana and later a diagnosis of mental illness, whether it's depression, bipolar, schizophrenia. what a lot of doctors, the opponents of marijuana, do is make the leap to call it causation. They say, oh, because they were using marijuana as teens, that was causing a problem later on. It was doing something to their brain, and now they're mentally ill. When in reality, when you actually are on the ground talking to these people and working with them and helping them, what we see is a lot of these teenagers have a preclinical diagnosis. They haven't been diagnosed yet, but they're still suffering. And in their suffering, they get introduced to marijuana, usually through the black market, usually through a friend, again, because the wisdom isn't being passed down through the generations the way it ought to be. They happen across marijuana and they like it because it's relieving their mental suffering, whether it's depression or preclinical schizophrenia or something like that, and they're using it. And they continue to use it. That's my theory anyways. That's based on what I've seen in my life, what I've known, and now what I'm seeing in my practice. I think young people that are borderline mentally ill find that marijuana is very helpful. I know a lot of adults that have had problems with depression, that have used pharmaceutical antidepressants, that have not had as much benefit as when they use marijuana. It's not for everyone. Like almost everything in the body, marijuana has this biphasic or two-pronged effect, and I think it's possible that in some individuals it would make depression worse. And I know that in some individuals it'll help depression quite a lot. The other thing about it, though, is that it's safe to try. The side effects are so minimal that it's often worth a shot. Any other questions?